The most commonly prescribed treatment for obstructive sleep apnea and the most effective treatment for obstructive sleep apnea is positive airway pressure. In positive airway pressure, we take advantage of the fact that we're obligate nose breathers at night and we want to breathe through our nose preferentially. We cover the nose with a small nasal mask or nasal pillows that plug in the nostrils. For people with problems breathing through their nose, there are full face masks, but we honestly try to avoid them because they're more cumbersome. When using a CPAP device, the individual breathes in and out at a regular pace, just like regular respirations, and the air that they breathe in is then humidified and pressurized. The idea is that the pressure of the air you breathe in while you're breathing in and out with CPAP is higher than room air pressure. And with a slight increase in the pressure of the air in your airway, that air pressure holds the airway open and relieves all of the apnea. A little bit of pressure will stop an obstruction, a little more pressure will resolve the snoring. So the symptoms of apnea can be treated very effectively with a PAP device by increasing the pressure of air in the airway and allowing the patient to breathe smoothly in and out during the night, oxygenate regularly, and wake up feeling refreshed and restored in the morning. Other treatments for apnea do exist, and the other major treatment available is the use of a mandibular appliance. A mandibular appliance is a dental device that's usually in one or two parts with an upper and a lower, and a mechanism to interlock them. Once adapted to sleeping with the device, it's adjusted to pull the lower jaw forward, and in doing so make a little more space for the airway. Mandibular appliances can be effective, especially with mild or mild to moderate obstructive sleep apnea. Other treatments are available, some of them behavioral. If the apnea that you have is predominantly while you rest on your back, there are devices that can be worn at night to teach you to stay off of your back and to entrain a side sleep position. And for patients with a strong positional component to the apnea, this can at times be an effective treatment. Although all patients with sleep apnea are not necessarily overweight, when you are carrying excess weight, addressing the weight problem and losing weight can be an effective treatment for apnea, or a treatment that one can use in conjunction with other treatments for the apnea. Successful weight loss is not easy, and our understanding of this currently is that it requires adequate sleep time, good quality sleep with well-treated sleep apnea, and an active exercise program. Exercise is critical to successful weight loss, and it's as critical as following a healthy diet with an emphasis on more vegetables and avoidance of complex carbohydrates. What we eat does matter, and how much we eat matters. When you talk to people with sleep apnea, you often hear that they feel vastly better once they're adequately treated, and they want to adhere to their treatment plan because it is so nice to have that restoration of energy, which provides an improved outlook on life in general. Managing sleep apnea is a process, and addressing the weight, the exercise, choosing the right treatment option are all important. Often there's a 6 to 8 week period of adaptation to whatever treatment you choose, but perseverance is important and the payoff is great. There's a huge improvement in energy, and when you talk to patients who are being well treated for their apnea, there is not only more energy but an improved outlook overall on life.